name is Drew Comerci. I'm one of the dentists here at Integrity Dental, and we are fielding a lot of questions involving Invisalign, so I thought I'd take some time today to answer some of the basic questions.
Great. Dr. Comerci, what is Invisalign?
What is Invisalign? Well, Invisalign is another way to move teeth other than traditional braces and brackets that are on their teeth. How does it work? Well, the first thing you need is an exam to figure out if Invisalign or clear aligners, and let me step back in saying that Invisalign is a name brand. We don't use Invisalign in Integrity Dental, but something very similar. We call it a clear aligners. So for a clear aligner case, first thing is to get a good exam to find out if it fit you well, if it's a good fit for your desire in moving your teeth. We take scans of your teeth, pictures of your teeth. We don't need to use any of the old-fashioned impressions in your mouth, but pictures and scans of your teeth. Then we work with an orthodontist to digitally manufacture the case and determine how many trays you'll need, how many clear aligners you'll need. And then we start the case. Depending on time, we'll be able to go over that with you in advance. How much time it'll take, are there any adjustments on your teeth, kind of slenderizing them, making them a little skinnier to make room for teeth to move. Sometimes we put little buttons on the teeth, clear buttons that help the trays grip the teeth and move them as we go throughout treatment. But it's very simplistic and generally a lot more comfortable for patients than traditional braces.
How does Invisalign compare to traditional braces?
Good question. How does Invisalign compare to traditional braces? Well, traditional braces are still considered the gold standard and are particularly the right way to go with more advanced or more complicated orthodontics. But for simple cases where we're just wanting to unwind teeth, make them straighter, close gaps, a lot of time the Invisalign or clear aligners is a great way to go. The way that differs from traditional braces is traditional braces have brackets, those little metal or sometimes porcelain brackets cemented on the teeth, and then wires placed across the brackets, and the thicknesses and the dimensions of those wires put the pressure on the teeth and move them in the desired place that we want the teeth to move. Clear aligners do something similar, but they do it with clear trays. So you put in a tray over your teeth, sometimes just the top, sometimes just the bottom, but most of the time both. You'd wear them together. And the trays are just putting pressure on the teeth in the right angles and positions that the teeth will move a little bit. You use the tray typically about 2 weeks, and then the next tray goes in, and it kind of inches the teeth little bit by little bit to the position that we want them to be. So the big difference is instead of brackets and wires, you're using clear aligners. You wear them all day. The only time they come out is when you're eating. Most people can't even tell that they're in. It doesn't affect speech. And generally speaking, it's a lot more comfortable than traditional braces.
Is Invisalign really faster than braces?
Treatment time is probably pretty similar.
Can you repeat the question?
Sure. Yeah. Is Invisalign or clear aligner therapy faster than traditional braces? Not necessarily. The traditional braces technique is going to give the orthodontist or the treating dentist the most control over the case and can often get the case done a little quicker. So clear aligners is comparable, but in some cases a little longer, but still in a very reasonable period of time.
Why is Invisalign often considered more comfortable than braces?
Why is Invisalign considered more comfortable than traditional braces? Well, Invisalign or clear aligners are exactly that. They're a clear tray that will slide over your teeth, very thin, clear, almost can't even tell they're there. It sits on your teeth and will subtly put pressure on the teeth to move them to where we want them to go. It's not all done in one tray. One tray goes in, moves them a little bit. Within a couple weeks, we put in the next tray, moves them a little bit more. So it's generally very comfortable. You don't have to have that feeling of the brackets or the wires against the teeth that can sometimes be uncomfortable in traditional therapy. So for that reason, typically speaking, clear aligners are more comfortable than traditional braces.
How long does Invisalign take to straighten teeth?
How long does Invisalign or clear aligner therapy take to straighten teeth? Well, that's a good question, and unfortunately there's not a straight answer because it very much depends on your individual case. It can be anywhere from 6 to 12 months on a real simple case, or sometimes 1.5 years, 2 years. So it's very case specific, but before beginning the case, the dentist would be able to tell you how long to expect.
Do I sleep with Invisalign?
Do you sleep with Invisalign or clear aligners? Yes, you do. The therapy needs to be as close to 24 hours a day as possible. So just like traditional braces that are cemented on your teeth that are in all the time, clear aligners need to be the same. We'd put them in, you'd wear them all day. The only time you take them out is to eat. You brush them, clean them, and they go right back in, and you do sleep with them.
Is there anything that could disqualify me from using Invisalign?
Is there anything that can disqualify you from being a good candidate for Invisalign or clear aligner therapy? Yes. Traditional braces with the brackets and the wires on your teeth is still considered the gold standard for more advanced, more complicated orthodontics. So in certain cases, yes, you need to have, you need to work with an orthodontist and work with traditional braces technique, the brackets and the wires. Clear aligners does the vast majority of cases. Most patients are good candidates for clear aligners, but the more simplistic the case, the more appropriate it is for clear aligners. So the best answer to that question is to seek an exam with your dentist and determine the complexity of the case and decide which technique is right for you.
Can Invisalign fix crossbite?
Can Invisalign or clear aligner therapy fix crossbite? In many cases, yes. Sometimes crossbites are very complicated and require specific treatment that is best suited for bracket therapy, traditional orthodontic therapy. So the answer to that question is yes, but not all the time. Again, the best way to know is to get an appointment with your dentist and go over the case and find out which therapy is best for you.
Is Invisalign painful?
Is Invisalign or clear aligner therapy painful? No. Traditional braces and clear aligner therapy is uncomfortable at certain times in the therapy. Just like traditional braces, when the brackets are put on and the wires go on, it makes your teeth, your gums and your lips a little sore because it's something new in your mouth, rubbing, and you're not accustomed to it. That discomfort goes away pretty quickly, but traditional braces can be typically sore every time you're getting new wires put on. There's more pressure applied to the teeth and it can be uncomfortable. Most of the time, patients don't use the word painful. Clear aligner therapy, thankfully, is generally less uncomfortable, less concerning for the patient. Every time you have a new tray put in, it puts pressure on the teeth, and that can be uncomfortable because there's pressure being put on the teeth. But thankfully, it usually will last for a period of hours, and patients say the pressure, the sensation goes away, and is generally very well controlled with ibuprofen or Tylenol. So is it painful? I wouldn't use the word painful. Uncomfortable, maybe make you sore, but thankfully mild and short term.
Does most dental insurance cover the cost of Invisalign?
Do dental insurances cover Invisalign or clear aligner therapy? Unfortunately, we can't say most. Some do. The best way to know is to get an exam with your dentist, develop a treatment plan, and then we can look at your specific insurance plan and get you that answer before beginning treatment.
How much does Invisalign cost without dental insurance?
How much does Invisalign or clear aligner therapy cost without dental insurance? The best way to know the cost is to get an exam, work up a treatment plan, and then determine the length of the case. The cost of Invisalign therapy is determined by how many trays you need. Each tray you use for roughly 2 weeks. So the more trays, the longer you're in therapy, and therefore the more expensive. But generally speaking, the cost of Invisalign or clear aligner therapy, at least at Integrity Dental, is anywhere between $2,500 and $3,500, but it's very case specific.
How can I schedule an appointment to talk with a dentist about Invisalign?
How can you get started with Invisalign therapy or clear aligner therapy? The best way to do that is to give our office a call and set up an appointment and let us know that you're interested. The appointment is generally pretty quick, anywhere from 30 minutes to an hour, where we look at your teeth, make sure you're a good candidate for Invisalign or clear aligner therapy, or if you need traditional braces. But of course, is there anything else going on in your mouth? Are there other concerns that need to be addressed first? So to start with, you need a good exam with a good dentist to tell you all that's going on in your mouth and make good recommendations. And then we go from there. We present a treatment plan, cost, length of therapy, insurance coverage, and then you get a chance to see it all before you begin. And the cool thing about clear aligner therapy is it's digitally designed. So our patients really appreciate when we do this exam and we work it all up. When you decide you're interested, we can actually show you digitally on your phone or your laptop at home. You can see your teeth three-dimensionally on where they are right then. And then each step of the way as you go through therapy, there's these little snapshots of how your teeth are moving, and then you can see the before and afters and decide, wow, that really looks good, I want that. Or, I like it, but can we move this tooth a little further? So you get a lot of involvement before you begin to make sure that you're going to be pleased with your therapy.
Call to action.
So if you have any interest in moving the position of your teeth, straightening teeth, closing gaps, getting a better bite, if you have any interest in that, I encourage you to call our office and set up an appointment. There's a good chance that Invisalign therapy or clear aligner therapy will work very well for you, and if it doesn't, We work with orthodontists here that'll get your case going from a traditional standpoint. But give us a call. Our phone number is 719 545 2468.